Hello everyone, my name is Ronald and today I will discuss about my final presentation of infectious diseases. I'm happy presenting to all individuals as anyone can get this infection, especially those with other disorders as you may be more likely to get sick if your immune system is weak. Infectious diseases, or sometimes we call it communicable diseases, are caused by organisms such as bacteria, viruses, fungi, and parasites. They are the leading cause of death worldwide, specifically among low-income countries and young children. People can be exposed to a number of different types of infectious diseases, including airborne, bloodborne, contact, and zoonotic diseases. Airborne diseases can be spread through the air when infected people cough, sneeze, or speak. A person becomes infected by breathing in air contaminated with virus or bacteria. Bloodborne diseases are transmitted through contact with infected blood or certain body fluids. Some common bloodborne diseases include HIV/AIDS and hepatitis B and C. Contact diseases are transmitted through direct or indirect contact with bacteria or viruses. Zoonotic diseases are caused by infectious agents that can be transmitted between animals and humans in a variety of ways. Each infectious disease has its own specific signs and symptoms. General signs and symptoms common to several infectious diseases include fever, diarrhea, fatigue, muscle aches, and coughing. Your doctor may order laboratory examination or imaging scan to help determine what's causing your symptoms. Laboratory examination may include blood test, urine test, throat swab, stool sample, and spinal tap or lumbar puncture. However, imaging procedures such as X-rays, computerized tomography, and magnetic resonance imaging or MRI can help pinpoint diagnosis and rule out other conditions that may be causing symptoms. Knowing what type of germ is causing your illness makes it easier for your doctor to choose appropriate treatment. For bacterial infection, antibiotics are usually reserved because these types of drugs have no effect on illnesses caused by viruses. For viral infection, antiviral drugs have been developed to treat some, but not all viruses. Examples include HIV/AIDS, herpes, hepatitis B and C, and influenza. For fungal infections, topical antifungal medications can be used to treat skin or nail infections caused by fungi. Some fungal infections, such as those affecting the lungs or the mucous membranes, can be treated with an oral antifungal. For parasitic infection, antiparasitic drugs treat these diseases, but some varieties of parasites have developed resistance to the drugs. There are many simple ways to reduce your risk of infectious diseases, and even prevent certain illnesses altogether. First is to get vaccinated. Getting the immunizations you need will protect you and those around you from infection and illness. This is a recommended schedule for children as well as a list of recommended vaccines and booster shots for adults. That includes annual flu shot. Avoid animal-borne diseases. Infections that can spread from animals to people, called zoonotic diseases, are more common than some may realize. If you have pets, make sure they get regular checkups and that their vaccinations are up to date. Take care in hospitals. Hospital-acquired infections known as nosocomial infections are a significant cause of illness and death in the United States and around the world. Because they house people with numerous diseases and infections, hospitals can become breeding grounds for infections. Practice food safety. Microbes thrive on virtually all food items, particularly food left at room temperature. Prompt refrigeration within 2 hours of food preparation can usually slow or stop the growth of most microbes. Lastly, good hygiene, which is the primary way to prevent infections. The first line of defense is to keep germs at bay by following good personal hygiene habits. Prevent infection before it begins and avoid spreading it to others by washing your hand. Cover a cough, washing and bandage all cuts. Avoid sharing dishes and eating utensils, and avoid direct contact with napkin, tissues, handkerchiefs, or similar items used by others. While the benefits of good hygiene are extremely helpful in reducing the risk of acquiring infectious diseases, studies found some disadvantages such as eczema, hangnail, and prone to skin allergies. Conversely, poor hygiene raises the danger of bacterial, viral, and parasite illnesses. In conclusion, anyone can get an infectious disease. Usually, no single method is 100% successful at preventing sickness. Thus, having a variety of routines will help you reduce your risk. You can protect yourself from potential threats by practicing the preventive measures. Thank you for your time today, and I am happy to take any questions.